Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Councilmember Priscilla Tyson, President Pro Tem of City Council and Chair of these committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of biweekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and the Workforce Development Committees. The goal of these hearings is to promote transparency and provide an opportunity for city residents to learn and to speak on legislation that impacts their lives. Further, the intent is to review legislation that will be on City Council's agenda for the following 2 weeks. Legislation covered tonight will be on Council's agenda on June the 6th. The speakers representing this evening include Columbus Public Health Commissioner Dr. Teresa Long, Department of Development, the Director of Community Development, Hannah Jones, the Civil Service Commission Director Amy DeLong, the Auditor's Office Deputy Auditor Robert McDaniel, and last but not least, the Department of Finance Deputy Director Dan Giangardella. I will start with the Health and Human Services Committee, and here to review legislation from Columbus Public Health, we have Health Commissioner Dr. Teresa Long. Good evening, Dr. Long.
Good evening, Council Chair Tyson and colleagues. It's good to be with you this evening, and thank you for the opportunity to share the upcoming legislation coming from Columbus Public Health. There are just 4 items to share with you this evening. The first is a contract modification with Local Matters for the Columbus-Franklin County Local Food Action Plan. It's Ordinance number 1383, 2016. I know this is an effort that is very dear to your heart. This ordinance would allow us to modify and extend a contract for the amount of $27,500 that would then take us to a total contract amount that we've had with Local Matters not to exceed $115,570 for the time period that now would end on November 30th, 2016. And as you are well aware, but perhaps the rest of the audience might not be aware, this has been something that Council Chair Tyson, you have really pushed forward, was trying to address the issues of food in our community and food access, food availability, local agriculture. It really is a total food action plan. And so indeed the effort has been going very well, but there is a need to extend and to continue to support the efforts of this, and the Local Matters has been providing strong community engagement efforts. So again, to further gather that community stakeholder input, we would request the consideration of the use of these funds that we do have available to extend the contract.
Thank you, Dr. Long. And so the $27,500 is to, again, gather more community input for this community action plan, local food action plan. And that's really crucial because you want to make sure that the entire community has an opportunity to be invested in this program by sharing data. So thank you very much.
You betcha. The next is to authorize a contract with an organization called Beyond Spots and Dots. It's ordinance number 1319, 2016. And this is to continue to move forward our Safe Sleep media campaign. I know we've talked a lot about the ABCs of Safe Sleep. We have received funding from the Central Benefits Healthcare Foundation, that is an affiliate foundation of the Columbus Foundation, to continue to implement our Safe Sleep media campaign. So this allows us to work with Beyond Spots and Dots that will be doing the media purchase for an amount not to exceed $68,000. And again, these services actually were advertised through a vendor services agreement and according to all of the billing requirements of Columbus City Code.
Thank you, Dr. Long. Will this be a continuation of what we've been doing already?
Yes, this will be a continuation of the current media campaign, and it will take us through December 31st of 2016.
I will also share, you'll sure appreciate this, that I happen to be, I spent a lot of time at the James, and I went into the cafeteria, which is a very healthy cafeteria now, as you know, that there were they have the TV screens, the monitors up, and certainly it had the ABCs of safe sleep in the cafeteria. So it was great to see that campaign in the hospital. So.
I love hearing that. And actually, we know that everyone, everywhere has contact with an infant. So we want every parent and caregiver and grandparent and aunt and uncle and cousin to know how to safely sleep an infant. I would just tell on you, you have been a famous cook with one of the James leading chefs. So good for you. I'm surprised they didn't have you come back and cook up a storm. So again, thank you for sharing that information. So the next item is a contract with Attentive Corporation for IT support services. And again, it's Ordinance 1396, 2016. And this allows us, the Board of Health, to enter into a contract with Attentive Corporation that will provide information technology services that will be used to support our electronic health record. As you know, we have made the switch. We have stayed with NextGen, but moved to have a NextGen vendor-supported electronic record system. In the process, we are now needing software to be upgraded to allow patient registration, the appointment scheduling, the monitoring, tracking of patient results, et cetera, to get them all connected to our clinic application. And so in this, the contract, this vendor will then review all of the existing templates. Because of the upgrade that NextGen is doing, we need to upgrade all of these aspects to our very specific electronic health record that they provide for us. So again, it's up to 260 hours of services. We feel confident that we can, with this $36,000, be able to get the upgrades that we need to continue using this electronic health record.
Thank you.
And then the last item to come before you is to accept and appropriate Healthy Homes Awareness Grant from the Ohio Department of Health, Ordinance 1387. This is a very small and a very quick agreement with the State Health Department. They are awarding us $10,000 to fund a Healthy Homes Awareness grant project. It actually says on the ordinance April 1st through June 30th. It actually will be June 1st to June 30th in reality. And the objective is to raise public awareness in certain zip codes, and I can review those if you'd like, about the benefits and the importance of having lead screening and a healthy home. So again, trying to educate and raise awareness through these kinds of outreach efforts. The State Health Department will actually be having a billboard campaign, and then we will be coming along with bus and social media and a variety of other ways to get people to be aware in certain zip codes, again, of the importance of lead screening and lead-safe housing.
Now, will you be doing this with your team of people, or are you going to be contracting with some to help you with this? How are you going to?
That's a really excellent question. And my understanding is that we will be coordinating and disseminating the advertisements through local social media. And so again, I don't believe there's subcontracts of this. So perhaps we have arrangements. I know the target populations or target focus zip codes are for 43204, 223, 06, 11, 229, 224, 05, 228, 07, 01, 03, and 232. These are all areas where we believe there are higher rates, or likely higher rates, of older housing stock or young children that might be particularly likely to have higher lead exposure.
And some of these zip codes are certainly the neighborhoods that we're focused on for our infant mortality.
Exactly. And again, we'll be reaching out. A lot of it's social media and Facebook, et cetera. So that I think we would manage internally. I don't believe there's a subcontract. Obviously, if there are subcontracts, you will hear about that from us again.
Thank you so very much. All right, our next presenter will be the Director of Community Development, Hannah Jones.
Good evening, Chair Tyson. Tonight I have two pieces of legislation for your consideration. The first piece is Ordinance 1392-2016, and while I review it, I would like to invite up the Interim Executive Director of the Central Ohio Diabetes Association, Ms. Laura Siegel, excuse me if I got that wrong, as well as Melanie Boyd, the Director of Development for the Charitable Pharmacy. This ordinance allocates $35,000 in funding to these organizations. $20,000 in funding will go to the Central Ohio Diabetes Association for their detection and outreach programs, and $15,000 to further the work of the Charitable Pharmacy of Central Ohio to provide access to pharmacy services. And I will allow Laura and Melanie to give you the specifics of their programs. Thank you.
Yes, that'd be great. Good evening.
I missed my cue. Good evening. How are you?
I'm fine, thank you.
Good. We just want to thank the council for your past support and the opportunity to testify today. I'm going to start with a story that one of our supporters told us. In 2014, there was a young temporary worker in my department who was a top performer. Unfortunately, she missed a lot of work due to illness. She was being considered for a permanent job, but the hiring manager was concerned about her absenteeism. The woman shared that she had asthma and could not afford her medication. The supervisor told her about the charitable pharmacy, and once there, the employee got her medicine and learned how to better manage her condition. Almost immediately, her performance improved. She was chosen for a permanent job at the state of Ohio in March 2015, was promoted in October, and she's doing great. We've been helping people like her since 2010. With council support and 6 years of operations, we have served more than 4,800 people, filling 250,000 prescriptions for a total value of medicine and pharmaceutical services of more than $23 million. Last year alone, we saw 1,500 patients and administered 120 influenza vaccines. We see anywhere from 40 to patients a day. 40 to 60
Thank
a
you.
day, yep. Depending on the day. They need only meet two conditions. They must be at 200% of the federal poverty level or below and be a resident of Franklin County. We are the only pharmacy in the city that both provides the services to patients at no charge and qualifies them for up to 12 months of continuous service. Our model sets us apart from other pharmacies working with underserved populations. When patients come to us, we sit down with them, either a pharmacist or a pharmacist intern, educate them about their medications, monitor clinical outcomes or markers like blood pressure and blood glucose, answer any health-related questions. We offer social program referrals and nutrition counseling. We know for some of them, we are their last stop. And if we don't get them the medication, they're not going to get it. Even with the improvements resulting from the Affordable Care Act, individuals are still facing high premiums and co-payments which they cannot afford from low monthly income. We ourselves are expecting a continued increase in need for our services and regularly have demand for more new patients than current capacity permits. The City of Columbus, and I can't stress this enough, is a vital part and valued partner in a diverse stream of financial support. We benefit from support from local hospitals, foundations, corporations, individuals, and last year we were very proud to be named one of the top 5 nonprofits to watch by the Columbus Foundation. We're excited about continuing our grant relationship with the city in order to take care of an ever-growing number of patients who would otherwise not be able to receive their medication. From the bottom of my heart, and on behalf of the staff and them, I thank you.
Well, I wanted to say thank you for the work that you're doing in our community. Certainly it is just a passion of mine to make sure that individuals who have health care needs certainly have the medication that they need to be able, should they have a health care need and they require medication, that they have the ability to get the medication.
Sounds like we're on the same side.
We're on the same side, absolutely that we are. So thank you for the work that you're doing. I see one of your team members over here in the back.
Yes, our former director, Alan Zanger.
Yeah, Alan's back here,
today.
yes. And thanks for coming, Alan, and just appreciated working with you over the years. And he's the one that really came here and started having conversations with me and others about the importance of the charitable pharmacy. And he and certainly Pastor Edgar and those guys came down and had this conversation about the importance of the work that you're doing, and it is really important work. We don't want anyone not to be able to get the pharmaceuticals they may need to keep them moving forward. I love the story that you told, and that's exactly why this is important funding. So thank you
Great.
for your work.
Thank you very much.
And next from Central Ohio Diabetes. And you just retired and now you're back at work, right?
You can't get rid of me. I recently retired as Director of Mental Health America of Franklin County last year and took some time off, and now I'm Interim Director here at CODA, the Central Ohio Diabetes Association. So thank you so much for allowing me a couple minutes on your agenda this evening. In 1964, a handful of doctors in our community created an organization to help people with diabetes learn to live well. 52 years later, CODA continues to help thousands of Central Ohioans detect their diabetes, and thousands of others, regardless of their ability to pay, learn how to manage their disease through self-management education, diet, and exercise. Camp Homway, our residential summer camp for children with diabetes, has served over 7,700 children. In the past 8 years alone, we have conducted over 86,000 screenings at over 4,700 events. An average of 16% of the people we tested screened high for diabetes. Over 13,000 people discovered that they had diabetes or that their already diagnosed diabetes was out of control. Those with abnormal readings, as well as those at risk for diabetes, receive follow-up information and linkage with community partners who offer health services, exercise, and education programs, including Primary One Health and the YMCA. We rely on the community to help us in our work. We have formal partnerships and collaborations with nearly 50 community partners and over 100 venue partners where screenings are held. We also work with 50 area churches, synagogues, and mosques, focusing strongly on African American, Somali, and Latino congregations. Diabetes affects over 137,000 people here in Central Ohio, 1 in 8.3 people. The cost in the U.S. is $245 billion for direct medical costs alone. That's $1 billion. Diabetes disproportionately affects minority, low-income, and underinsured populations. It can go undetected for years while continuing to damage the body. Over 50% of people diagnosed with diabetes find out only because they've already developed one of the potentially life-threatening complications. Diabetes is the 6th leading cause of death in Central Ohio. The CDC reported that the number of adults with diabetes has more than tripled during the past 20 years. These are sobering statistics. As a result of changing funding priorities, our detection program is in jeopardy without additional funding. The loss of this program, along with our community-based workshops, would strongly impact high-risk, underinsured, and uninsured low-income individuals. It would also have a worse effect on seniors and some minority populations whose resources and access to services may already be severely limited. Support from the city will allow us to complete 2,800 blood glucose screenings at 160 community-based events focusing on high-risk locations in the next year. Combined with funding from Franklin County and Anthem, you will help us provide programming that will prevent or delay the onset of diabetes and prevent or reduce diabetes complications. One quote from a client I'd like to read: "I learned more about diabetes in the class you offered than I have learned since being diagnosed in 1989, over 25 years ago. You helped me bring my A1C down by 5 points. I've stopped drinking pop, increased my water intake, and now I eat half a plate of veggies with just a small amount of meat. You guys are lifesavers." Since I began speaking 3 minutes ago, 8 people in the United States have died from a diabetes-related illness. Thank you, Councilmember Tyson and members of City Council in the hearing here today for your advocacy and support in carrying out our mission.
Well, first of all, thank you for certainly coming down and sharing all the statistics that you did today. In April, I held a minority health hearing, and we held it over 2 days. And one of the areas that certainly, and the Columbus Public Health presented the information because through their Office of Minority Health. And what we realized, and we shared this information, was that if you think about kind of the 4 areas, there's 4 areas where we know that minorities tend to have more illness than any the other or the individuals. And they shared the 4, and one of those 4, of course, as you know, is diabetes. Mm-hmm. And so once you hear this information, you start to think about, if you're funding organizations, who's focused on the issues that we have, the significant issues in our community, especially around all the areas that I work with, and the one, of course, is health. And certainly the information you shared about African Americans, the Latina and the Somali community certainly have higher incidences of having diabetes than other individuals. So I do appreciate the work that you're doing, and that you're certainly focused a lot of this work, on the whole community, but you have an understanding of what's really going on in the community and the work that you're doing in our churches. And also when you're out in the community at the different events, that you're also focused a lot on these minority populations. And I do appreciate that, because it is a significant issue in our community. So that's one of the reasons why I think it's so important that we continue to fund you, because it is such a, it's more people, or more African Americans and other minorities are having diabetes-related complications than anyone else. And so I appreciate the work that you're doing. And I think you probably have some partnerships also with the charitable pharmacy. People have to go there and get their medicine, so that's important. We want to make sure people can get the medicine that they need so they don't develop other problems. And so thank you for coming here. I look forward to sharing this with my council colleagues and continue the support of the work that you do.
Thank you so much. I appreciate it.
Thank you so very much.
The second ordinance for your consideration this evening is 1393-2016, and while I'm going over it, I would like to invite Ernest Perry, the head of HandsOn Central Ohio, to come up. This ordinance grants $100,000 to HandsOn Central Ohio to continue a service that they have been providing, which is a mobile phone-based emergency food scheduling service to some of our high-priority neighborhoods. And I will let him review the specifics.
Good evening, Mr. Perry. In the last ordinance, the total amount was $35,000, and this ordinance you mentioned is $100,000, and this was a pilot program for us last year. So glad you're here and to testify on this legislation.
Good evening. It's always a pleasure to stand in front of you and represent HandsOn Central Ohio and talk about the work that we do in partnership. About a year ago, we collaborated on a really innovative social solution to address food insecurity in some of our priority neighborhoods, Linden, Franklinton Hilltop, and the South Side. Those areas where the data had shown us we had residents that were experiencing the greatest need, and also had food resources available in some of our food pantries that we could strengthen linkages around. And as a result of that, I want to share some of the outcomes that we experienced through that partnership. And first of all, the service, which uses a resident's mobile cell phone to provide location-based real-time access to emergency food, has a 100% success rate. It does not fail. Every time a resident sends a text message and says, "I'm in need of food," they get exactly the food they need when they need it, in proximity to where they're asking. 43% of the residents now who are accessing emergency food from pantries in Linden, the South Side, Franklinton Hilltop, that participated in the pilot are using this service as their primary mode of communication. Those pantries are, as a result, serving 31% more residents, 31% more food. And so what we've been able to do is provide an easy, convenient way for residents to access food, and also improve the operating efficiency of the pantries that we targeted through the pilot. So they're giving away more food to more people, and then more people have easier access to food. This has also had a larger impact on emergency food access in this community as a result of being able to free up capacity to pursue other ways to distribute food. We're seeing the entire system is now delivering 20% more food. So the pilot that we focused on with 14 pantries in those key neighborhoods, Linden, Franklinton, Hilltop, and the South Side, has really had a huge network effect, and as a result, I think returned a huge value to this community, which is what we set out to do. These are all impressive numbers, and I hope that you agree as well. And I wanted to share with you that as a result of this particular pilot program, We competed successfully a few weeks ago at the Ohio Association of Nonprofit Association Conference, and were selected out of competitors from around the state to receive the Ohio Nonprofit Excellence Award for this program. So I wanted to show you this amazing trophy that represents our partnership on this particular service. And if you wanted to take a look, it's a pretty heavy piece of hardware, but just one proof point of the power of the partnership through the numbers in the community, but also the recognition that we have received around the state of Ohio for this collaboration. I wanted to thank you for your consideration of refunding this service and continuing it in these important neighborhoods, your continued partnership, and look forward to finding ways to grow the impact of this award-winning service between HandsOn Central Ohio and the City of Columbus.
Ernest, well, first of all, the numbers are impressive. And I know that when you certainly came to me and talked about this idea as to what we could do in an effort to make sure that more individuals certainly were being able to have access to the food that they needed, have access to it in their own communities, and be able to have and have not just access, but getting it access quickly, being able to get what they needed. When you share the numbers, we also, as you said, we talked about, we knew that we had pantries in communities, but people weren't even using those pantries, and how this program allowed that to happen. So I'm excited about it. Certainly, we wish we didn't have to have people going to food pantries. I want to make that clear. Absolutely. But recognizing the fact that that we do. People are trying to stretch their dollars. Dollars don't stretch as far as they want them to go. They have to utilize our food pantries, and I'm glad that they are able to get to them pretty quickly, get what they need to be able to take care of their families. So I appreciate your out-of-the-box thinking. You know, I'm always saying, come bring me something that's out of the box, things that we're currently doing. We may not be, they may be working fine, I'm not going to say anything about that, but we also need to think outside the box to solve some of the issues that we have. And that's why you got this award, because you thought outside the box, and we were able to the city was able to help you think outside the box to make sure that we give more access to individuals. And so again, this $100,000 now will continue the programming that you're doing. I know that you certainly also want to have, you love to have it citywide based upon the success of it, and it just requires more dollars to be able to do that. So I haven't forgotten what you've talked to me about, but hopefully this $100,000, which is a pretty significant amount, as you can hear the amounts we're giving out, but we so believe in people having access to food. That's a basic need, just like there's those basic needs to be able to have prescription drugs. Those are just basic things that everyone should have. So thank you for what you're doing. Just appreciate your partnership. We're going to get this back to you. We're not going to keep your award, and congratulations on this amazing award. Take a picture of it for us. We'll get a picture of this, but it's great that it's a good public-public partnership that allowed this to happen.
Thank you.
Thanks, Ernest. Thank you so much. And our next presenter is going to be from the Civil Service Commission, the Director Amy DeLong, to present her legislation. Good evening, Director.
Good evening, and thank you, Chair Tyson. Coming before you on June 6th will be a not-for-profit service contract with Workforce Development Board of Central Ohio and the Central Ohio Workforce Development Corporation, COIC, for the 2016 Restoration Academy for $200,000. While I give you a little background information, I would like Frankie Nalan to come forward. Read a little article that I wanted to bring before you today. It says, a strong U.S. labor market is creating competition for talent in all sectors of the economy, from highly technical to low-skilled workers, driving businesses to expand their talent pools. In some industries, this means considering or increasing hiring programs for people with criminal histories. Historically, individuals with criminal records, and particularly those who have served time in prison, face numerous barriers to employment. As President Barack Obama mentioned January 12th during his State of the Union address, chronic unemployment among people with criminal histories has a far-reaching negative impact on society. That being said, I think that was the primary reason or one of the most important reasons why the program, the Restoration Academy, was started. And Restoration Academy is a rigorous 4 to 6 month program, provided experience to those with criminal backgrounds. What we hope to do is work with our partners, which is COIC and several community organizations. The goal of the Academy is to provide those restored citizens in Franklin County with work experience, with paid work experience, ongoing job training, and supportive wraparound services that lead to, hopefully, permanent family-sustaining employment. And with that, I would like one of our and most important partners in this adventure, Frankie Nalan.
Thank you. Good evening, Councilwoman Tyson.
Good evening.
With 4 successful graduating classes of Restoration Academy, the results have been praiseworthy and a testament to removing commonly held notions about restored citizens. These individuals have shown extremely high motivation, dedication, and desire to overcome personal barriers through performance while employed. Their commitment to success cannot be questioned. Without the partnerships, as Amy had pointed out, and without the funding from the City of Columbus, Restoration Academy would not be a success. Since 2012, 114 of the 139 participants have found gainful employment, with 2/3 of these graduates now working in the private sector. Furthermore, 82% of the participants who have graduated are still working at least 2 years or more.
Excuse me, Frankie, could you tell me the number again, the numbers that you gave?
114 out of 139
Okay.
graduates.
Thank you.
City of Columbus placed or hired 38 of the Restoration Academy, and they have proven to be as successful as the private sector placements. In 2014, Restoration Academy implemented changes by increasing the number of participants. The first 2 years, there were one cohort each of 15. The third year, we raised the number to 50, with 2 cohorts per year. Each class increased the number of private sector employers providing gainful employment with benefits. In 2015, all 49 graduates obtained permanent employment in high-demand occupations such as business and professionals, healthcare, information technology, and transportation. In the 4 years of Restoration Academy, we conservatively estimate over $3 million in combined wages and benefits have been earned by graduates. The economic impact of this level of success is realized within the families and community of the participants. To quote a 2015 graduate, "This program has allowed me and my family the ability not to just rent housing, but to purchase our home." Although there have been an increased emphasis toward employment in private sector jobs, Restoration Academy will continue to work with the City of Columbus and Franklin County to secure work experience within various departments, hopefully leading to permanent employment. For 2016, Restoration Academy will have 2 cohorts of 25 each. This year, we will have 1 cohort for ages 18 to 24, which we consider as young adults, and the second cohort, ages 24 plus, will be considered for the adults. There are over 120 prospective candidates for Restoration Academy. Activities for the adults, we have a minimum of 32 participants right now who are being interviewed and being ready to be enrolled into the program. And from the young adults, we have 26 viable candidates to start. In 2014 and 15, we had 42 employers, from private businesses as well as nonprofit organization and the City of Columbus and our partners who provided internships. So far this year, we have 24 prospective businesses as well as nonprofit organizations. We thank the City of Columbus for being our funding partner, and we hope to continue and go into our 5th year with as much success as we've had in the past.
Thank you, Ms. Nalan. This is a program that I am just thrilled about, and you're absolutely right. I think what Mr. Long mentioned too, that with the low unemployment we're having across not only our city, but many other cities, certainly we are going to need to make sure that individuals who have the capacity and the capability and want to work, we're going to have to begin to work with individuals that may have come through a program like Restoration Academy. I mean, it's just, I mean, it's going to be with individuals who are leaving the workforce and not as many of them coming into the workforce, so we're going to certainly need individuals who deserve a second or another chance, and that's what this program is really about. Certainly want to thank our former mayor, Mayor Coleman, for implementing this program, doing his administration, and certainly it's been carried out, continuing on. Appreciate the work that you have done at COWIC, certainly the work that through Amy DeLong and her team at the Civil Service Commission, and all the partners who have participated in this, because I know those partners are doing it, not even being compensated for to be a partner over the 4 to 6 month period. And so this is this program is such a success. And as you know, I'm going to have some guests coming from across the country. My colleagues from across the country are coming here in July, and one of the programs we're highlighting is going to be Restoration Academy, because I don't think there's anything like this going on across the country. So I appreciate that we're giving individuals another chance. Certainly, you think about the $3 million that the wages and benefits that these individuals have received. Of course, that helps us with sales tax, getting us sales tax, but income tax for the City of Columbus. But it also does something else, as you mentioned. It really does bring, it helps a family and a community, because people want to go to work. And if individuals in a family see a family member going to work, they're going to want to go to work. And again, the community becomes, this individual's not buying up one of them, buying a house in the community. That's important. So everyone wins with Restoration Academy. So I appreciate all the work that you're doing. If an individual, they need to share this, because I know you're looking right now, I'm excited about the program for the 18 to 24-year-olds. I'm excited to see the results of that program. You said you have 26 people already for a class that you know you're going to have a class of 25, and then you're going to have 32 candidates already for the class of 25 for the 24 and up. So, but if an individual wants to get involved in this program, how can they do that?
They will just call Teresa G. at COWIC, and do you want to?
Yes, tell us the number.
614-559-1333, and just say that they are interested in Restoration Academy. Now, we're always having a waiting list, but we also work with restored citizens throughout the year.
Right.
They don't have to be in the academy for us to work with them, because we also have partners that we can refer them to or work with them, you know, internally to help them find employment.
Excellent. Okay. All right. Well, thank you. And this legislation is for $200,000, and it will be brought before my council members on June the 6th.
Thank you.
Thank you so much. And our next presenter will be from the Auditor's Office. It will be Deputy Director Robert McDaniel. Hi, Bob.
Hi. Good evening, President Pro Tem Tyson. Tonight we have one ordinance for review. Ordinance 1405, 2016, from the Division of Income Tax. This ordinance is for a business analyst in the Division of Income Tax. The contract is via a state term contract with computer aid in the amount of $120,000. This will be the second year for this. This analyst is analyzing the division's policies, procedures, and operations, and seeing how best to improve this within the new systems with the Division of Income Tax is now currently using. This is budgeted within the division's 2016 budget. I can answer any additional questions you might have.
Thank you, Mr. McDaniel. And so this is our second year. And are you seeing success?
Yes, we are, very much so. Proof will be in the end result when we get it all completed, but yes, we've seen some substantial changes in the process that have streamlined between us and the treasurer and getting cash in faster.
Well, thank you very much, and I'll be happy to present this legislation to our colleagues in June. Thank you. And then our final presenter tonight from the Department of Finance will be our Deputy Director, Dan Giangardella. And now we say the best for last today?
Well, I certainly hope so.
Okay, thank you. All right.
Thank you. President Pro Tem Tyson, we have 6 ordinances in the Finance and Management Division. One of those ordinances, 0781, 2016, I think was discussed at a previous hearing, and that is basically just completing a grant from some capital funds generated and used for the Clean Cities program, installation of some CNG equipment at a couple locations we had. Again, that was about $19,000. The new ordinances and the ones we also expect for the June 6th meeting include Ordinance 1357, 2016. This ordinance authorizes basically $105,000 in the Development Services Fund so that a purchase order can be issued by the Finance Director to purchase 4 Ford pickups, Ford F-150 pickups, for the Department of Building and Zoning. These would be used for inspectors out in the field, and obviously they will replace 4 vehicles that have high mileage and maintenance cost, and obviously we'd like to replace those and get those out of the fleet. The purchase order will be with Buyers Ford, and that is a UTC Universal Term Contract that's already established for that purpose.
Thank you. And can you just share, once we take vehicles out of the fleet, what happens to them?
Typically, the city will do its best to place those in an auction. We usually do an online auction and usually have done quite well in getting money back for those vehicles. And typically, depending on the fund that purchased those vehicles, oftentimes, if it's a light vehicle, in this case a pickup, those funds would typically go in the General Permit Improvement Fund. I believe the most recent auction that was completed in the last few weeks, I think will net the city close to $300,000, roughly half of that. Probably for public utilities, but again, so there is great value in these salvage vehicles, and since the city went to the online auction, I want to say about a half a dozen years ago, the amount of money we have received has increased dramatically for salvaging them.
That's excellent. And glad that, obviously the city made an improvement as we committed to our residents. So having the online auction has absolutely brought in more money for the vehicles, which is wonderful. And then again, these vehicles are the ones that have very high mileage and sometimes are the fuel efficiency may be not be as fuel efficient, so we're buying these newer vehicles. So thank you.
Yes. The next ordinance, 1377, 2016, again authorizes the Finance Management Director to issue 3 separate purchase orders for upfitting some vehicles that were purchased this year. They are 3 separate purchase orders, all that were bid. The first one will be a purchase order for Ace Truck Body. They are going to upfit 3 dump trucks for the Golf Division, small dump trucks that they will obviously use in the upkeep. The other purchase order will be with a company called Almarid, which will upfit a compressed natural gas vehicle, a Ford pickup for the Finance and Management Division, Facilities Management. And then lastly, a purchase order with Koffenberger, which will purchase and install a plow spreader and a salt spreader for finance. So in the winter months, we have something that can help us remove snow from the ground. The total expense for this will be just under just a little over $37,000. That will come via the Fleet Management Division from the funds set aside for the procurement and upfit of vehicles via the Special Income Tax Fund, and that is a budgeted item.
Thank you.
Ordinance 1384, 2016 will again authorize the Finance and Management Director on behalf of Fleet Management to modify and renew a contract with a company called API Security Services. This is the company that provides security services at the Fleet Management Building at 4211 Groves Road. The total amount for this will be roughly $107,500. Approximately $35,000 of that will do nothing more than to renew the current contract. Some of the funds were canceled off of that contract on the current system, on the current contract, so there's actually no additional cost there. We're just those were canceled off inadvertently, so those will be placed back on the current contract. And then the second part of this, for $72,000, we'll renew the contract for an additional year, taking this into next year. And this was originally a bid contract in 2014. This is one of the options for renewal that the Fleet Management Division is asking that council exercise.
Okay, I want to make sure I have this correctly. So the $35,000 is a modification on the previous contract.
Right. The current contract, which will, I believe, go through the end of August. Some of those funds at the end of last year were canceled off inadvertently, so we are putting those back on. Well, obviously, we need council authorization to do that. So it's essentially an accounting correction, but an additional $72,000, which is in the fleet management budget, will renew that contract beginning September 1st of this year, and that will continue into August of next year for those security services.
All right, thank you. And so it's for $107,500 for the security of the fleet management facility, which is the facility that does all the repairs on pretty much all the city vehicles and the CNG. Has our CNG, I don't say
fuel location.
Fuel, right. Yeah. There. Okay.
Yes, we have both CNG and regular petroleum fueling there, and as you know, that is our main facility, over 100,000 square feet, which repairs the majority of our vehicles, including nearly all of our safety forces. Ordinance 1385, 2016. This is an ordinance that essentially is arising out of the city attorney's office for the city to accept real estate conveyances for various purposes. Typically, and I believe these come to council a few times a year. These are mostly private development agreements where the city has needed right-of-way for either water or sewer lines, traffic signals, perhaps ADA placement of sidewalks or bikeways. Again, we receive no funds for these, nor are we paying any money for this right-of-way. It's essentially making sure that we have a formal acceptance of these easements for this real estate. So in the event that we would have to get on that property, we're able to do so.
Right, thank you.
Yes. And then finally, Ordinance 1456, 2016 will authorize the Finance Director to renew a contract with 2K General in an amount of $20,000. 2K General does some minor repair and maintenance on certain city facilities. This particular one is up to $20,000. This was originally a bid contract, and this renewal will go through April of 2017. So in the event that we have a small facility improvement that needs to be done quickly, 2K General or any other vendor that we would have in our contract is able to do that and complete that work appropriately in a timely manner. Thank you. And I'd be happy to answer any other questions you might have.
And this was Is this, I'm asking, is this, I'm looking at this, was this a,
This will be this will be the second year, I
Okay.
believe,
Oh, I see it.
of a
4 year.
contract that was established last year. We can go up to 4 renewal options, of course, with the approval of council.
okay, thank you so much.
You're welcome.
I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, the Department of Development, and the Civil Service Commission, as well as the finance-related legislation that is necessary to support our ongoing city operations. As residents, these hearings are an opportunity for you to learn and to become engaged in issues that are presented. Before I conclude tonight's hearing, I would like to thank Columbus Public Health Commissioner Dr. Teresa Long, Department of Development Director of Community Development Hannah Jones, Civil Service Commission Director Amy DeLong, and the Auditor's Office Deputy Auditor Robert McDaniel, and last but not least, the Department from the Department of Finance Deputy Director Dan Giangardella. I also always want to thank my fellow council members and their staff who work each and every day to serve our community with pride. I also want to thank City Council's Legislative Research Office, especially Michael Kessler, who leads the Legislative Research Team, and Andrew Dyer, who staffs the Health and Human Services and Workforce Development Committees, and also Matt Erickson, who staffs the Finance Committee. Also my staff, Nicole Harper and Carl Williams, who are here with me tonight, as well as Matt is here tonight. And also I want to recognize another individual that's here tonight, Nancy Sully, who is our Senior Community Outreach, these new titles, Community Outreach. And then I thank the hardworking team from CTV who make these hearings possible. And last but not least, I want to thank the residents of our city. It really is a joy and a privilege to serve the residents of our city, and they make our city really the best place in this country to live, work, and to raise a family, and our job is to work for them each and every day. So with that, I will say this hearing is adjourned. Have a safe drive home and enjoy the beautiful sun outside. Thank you.